All right, let's talk about stress. We all feel it, we all know what it is, but today we're going to pull back the curtain and see how healthcare professionals look at it. For them, it's not just a feeling, it's a complex clinical challenge that needs a very systematic approach. So, what does that actually look like? Let's dive in. So, what really happens when everyday stress crosses the line and becomes an actual disorder? You might be thinking, okay, you go see a therapist, right? But the reality is, well, it's way more structured than that. And honestly, it's pretty fascinating when you see how it all works. And yeah, just take a look at this. This gives you a little glimpse into that clinical toolkit. It's not just one thing. They're looking at the whole person. You've got nutritional management to get the body right, high-tech info systems to make sure the whole team's on the same page, major safety goals, and of course, crisis intervention for when things get really tough. It's a whole suite of tools for a really complex problem. Okay, so to really get our heads around this, let's start with the big picture. Before you can treat a single patient, you kind of have to map out the entire territory. You need to understand the whole landscape of these stress-related disorders. And that big picture view, it all starts with data, cold, hard data. Before they even think about treating one person, they're looking at the problem on a huge scale. They're asking questions like, okay, how many people are actually dealing with this? Who's most likely to be affected? And what does the journey with this disorder usually look like over time? Getting a handle on that macro level stuff, that's absolutely step one. So you might be wondering, okay, that's great for research, but how does that help an actual person? Well, that's the thing. It's not just guesswork. It's not throwing stuff at the wall to see that sticks. There's a really clear, methodical path they follow. And here's that path, broken down into 3 main steps. First up, assessment. This is all about figuring out, is this just normal everyday stress, or has it tipped over into something more serious? Then, step 2, diagnosis. This is where they use very specific criteria to actually put a name to the problem. And finally, number 3, planning and implementation. This is the part where they build a custom care plan and, actually put it into motion. And this is super important. This is not a one-person show. Not at all. That care plan we just talked about, it's put together and managed by a whole team of experts. I'm talking nurses, nutritionists, therapists, doctors. They're all working together to make sure the care is as good as it can possibly be. Okay, so I know that 3-step process can sound a little, well, abstract, clinical, right? So let's make it real. We're going to zoom in and see exactly how this plays out in a very serious, real-world situation: eating disorders. I want to start with just one number, a really stark one: 30%. What does that mean? Well, when someone with anorexia nervosa loses 30% of their ideal body weight and does it rapidly, that's a red line, a huge one. It's a signal of a full-blown medical crisis, and it's what triggers immediate hospitalization. So, boom, the patient is hospitalized. And this is where that clinical process we talked about kicks right into gear. But notice what the first step is. It's not talk therapy, not even close. The number one absolute first priority is just stabilizing them medically. And it makes total sense when you think about it, right? A brain that's literally starving can't do the hard work of therapy. You have to fix the body first before you can even begin to work on the mind. Okay, so once the patient is out of the woods, medically speaking, once they're stable, then the focus can shift. Now, with the body on the mend, the team can start digging into the root of the problem. And that's where behavior modification comes in. This is the part where they start to, unravel all the tangled thoughts and patterns that are driving the disorder, whether it's anorexia or bulimia. And this is where the real work, the really hard work begins. This quote just says it all, doesn't it? Recovery is not a quick fix. We're talking about a long-term journey, something that can take years of incredibly hard work from everyone involved, the patient and that entire team we talked about. Okay, so we've seen the how, right? The nuts and bolts of the clinical process. But what's the why? What's the end game here? What is the actual goal of all this incredibly intense, long-term work? Let's zoom back out and take a look. And one of the most crucial things to remember is that this journey is never a solo mission. It can't be. A massive piece of the long-term puzzle is building a rock-solid support system. And that means having services not just for the person going through it, but for their family too. Everyone is part of the healing process. And this, right here, is what it's all about. This is the heart of it. Forget the charts, forget the numbers on the scale for a second. The real goal, the human goal, is helping that person find their way back to themselves, to restore their sense of self. It's a total rebuild from the inside out. And ultimately, this is the destination. After that long, difficult, structured journey, this is where it's all heading. It's not just about keeping symptoms in check. It's about getting to a place of, wow, total self-acceptance, a truly profound goal. Which leaves us with a pretty big question to chew on, doesn't it? If the real goal is something as deep as self-acceptance, not just, a quick fix, what does that say about how we should build our healthcare systems? I mean, what would a system really look like if it was designed from the ground up to support that kind of deep, long-term healing? Really makes you think. Thanks for digging into this with me.